You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
So, you think you have skeletons in your closet? Come to Sternberg Museum, where we let our skeletons out of the closet.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start Grant. And with me today is Marianne Shorman. Welcome, Marianne.
Hi. Nice to be here.
Nice to have you here. Now, first of all, Marianne, tell us what you do.
I am the lead nurse for USD 49, and I am a school nurse. I actually have two schools. I have Fountain Middle School and Washington Elementary.
Okay. So I bet you get to see everybody that has a scraped knee or a runny nose, things like that.
We see a lot of kids with a lot of with little injuries. We see a lot of kids that have special health needs that we write care plans for and just kind of manage care. We do vision and hearing screening, coordinate dental screenings. We have a lot of things we do.
So probably more than most people would ever imagine that a school nurse has to do.
Right. When I first became a school nurse 22 years ago, I think people thought we kind of sat in our offices and took care of scraped knees and bandages and that kind of thing. But we don't really do a whole lot of that. I think sometimes other people do that, and we're doing all the other many things that we do.
Now, I know one of the things that you take care of and probably manage the records for are immunizations for the school year for all of our students. Now, can you tell me a little more about immunizations and students when they first start to school?
Sure, and that is one of our big jobs when we first get back into school is our immunization screenings that we do. Our children that will be entering kindergarten, in fact, enrollment is this week, the week of August the 4th. Our kids are, the kindergartners will be needing to have a health assessment, a physical by a doctor. Any child entering school for the first time in the state of Kansas under the age of 8 has to have a health assessment. Our kindergartners also need to have a dental screening by a dentist. And then their immunizations, they need to have, there are several. They'll need to have a tetanus, diphtheria, pertussis. They need a polio. They also need a second MMR, which is the measles, mumps, and rubella. They will need a second varicella, which is our chicken pox. And then they all have had to have had their 3 hepatitis B, which most everybody starts now at birth and completes within their first 6 months of life. So those are the immunizations that all of the new students, the kindergartners, will be needing to have when they come into school for the first time.
Now, I had a kindergartner last year, so we got to go through all the shots, but, it's such an important thing for the safety of all of our students that has to be taken care of.
That's right.
Now, what about older students? Do any of our older students need to have any sort of immunization?
They do. Actually, it used to be that you would get a 10-year booster for your tetanus, and they have added pertussis to that now for several years. And last year was a big year for school nurses because we had a lot of immunizations that kids needed to be caught up on. There are more requirements. Everyone who is coming in as a 7th grader this year needs, we call it a Tdap, a tetanus, diphtheria, pertussis booster. So all 7th graders will need to have evidence of that. Now, most of our students are going to be okay coming in because last year it was 6th grade. And so most of them will have that, but I know I sent out, probably 20-some letters from my school last year of kids that would be needing that booster shot. So they're going to need that tetanus booster.
Okay. So that's something parents of 7th graders are going to have to remember pretty quickly.
Right.
Yes. Now, I know one of the things that has really been in the news is the H1N1 virus. And I know through the school district you take lots of precautions and help coordinate immunizations and things like that. Could you tell us a little more about that?
Sure. H1N1 was really big last year, and when school convened again, we had an H1N1 kind of flu plan, precautions that we would take, and in a plan we vaccinated a lot of children at school with the H1N1. This year, H1N1 will be part of the regular flu shot or flu vaccine, because a lot of kids don't get a shot, they'll get a nasal vaccine. So it's part of the regular flu vaccine. They have now they're encouraging everyone. They've dropped that age for that. They used to encourage the flu shot for older people. They encouraged the H1N1 for the younger kids. Now it's everybody. So that will be part of a regular flu vaccine. And as soon as that's available, they are really encouraging everyone to get that flu vaccine, whether it be through your Ellis County Health Department or through your primary physician, but just that everybody get that. Precautions that we will continue to follow in the school setting is hand washing. That is key. That everyone wash their hands. That prevents a lot of illness and spread of illness. Using a tissue when you blow your nose and disposing of that, and then washing your hands. And if hand washing is not available, hand sanitizer still is a very good alternative. But always when you have a chance to wash, you should wash. Coughing or sneezing into your arm, that's right, just like you did there, is a good thing to do. Keeping your child home when they are sick, so that you are not bringing them to school and spreading that to other people.
Now, that kind of brings me to my next question. What are the guidelines that a parent should follow when it comes to keeping your child homesick? I know I'll feel their forehead if they have a fever, but are there guidelines that you would suggest to parents?
Yes. Anytime your child has a fever, and a lot of times, we will feel them and they feel hot, but that is just kind of a little basis. You should everyone should maybe own a thermometer if they can, and take your child's temperature. They should be fever-free for 24 hours without any medication. We'll give our kids Tylenol, and it brings the fever down, and then maybe we send them to school. But really, when that Tylenol wears off, that fever spikes back up. So really, we encourage parents that 24 hours without the use of a fever-reducing medication to keep them home. Anytime there's vomiting or diarrhea or lots of respiratory drainage or cough or drainage of the eyes, that they should keep them home so that we're not spreading to other kids. And those are kind of the same guidelines we use at school if we're going to be sending a child home, as far as temperature and cough and vomiting and diarrhea. So.
I know as a parent, sometimes it's hard to make those calls. So those are some good guidelines to help us follow. Now, if someone had more questions, they wanted to get some more information, would they contact you, or who do they call?
There's a school nurse for every school, and all of us have more than one school, but I would contact the school nurse in your school, would be a good place to start. And if there are any other questions, they can always contact me. I would be happy to answer any questions that I can.
Okay, so they would just call their main school office and say, I need to speak to the school nurse.
Correct. And your school nurses are a wealth of information and a very big help. So I would encourage you to always contact your nurse if you have questions or need to share anything about your child's health, especially with the start of school, when we are planning for needs of children. Share that information with your nurses.
Well, thank you for all that you do for our children and keeping them safe and healthy. Thank you for being on our show today.
You're welcome.
You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember you are your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.